All right, we are back. This is Dr. Lisa L. Campbell. It's part 5 of week 4, Introduction to CPT HCPCS Coding. And we're leaving with our last chapter, very short, Hemic and Lymphatic System. So, as usual, this chapter starts off with objectives, key terms, anatomy, common procedure, guidelines, and coding, and more coding. All right. So, as it relates to the hemic and lymphatic system, the anatomical structures that you're going to see here are the spleen, bone marrow, lymphatic nodes, and lymphatic channels. It should be noted that the spleen is the largest organ of the lymphatic system. It is located in the upper quadrant of the abdomen behind the stomach, just below the diaphragm. And its main job is to filter blood. All right, so these are the applicable subsections in this area as well. Oh, I just talked about that. All right, so lymphatic channels or vessels, these guys transport fluid away from the tissues of the body and toward the thoracic cavity. Lymphatic vessels transport fluid in one direction only, and that's away from the body tissues. Lymph nodes, also known as lymph glands, are in various parts along the lymphatic vessels, and the nodes are a collection of lymphatic tissue. On to some codes. So, there are 4 subsections for procedures completed on the spleen. We have excision, repair, laparoscopy, and then introduction. So, in the excision area, this is where you're going to see codes for a splenectomy, and that's the surgical removal of the spleen. And the codes that you see first in this family, 38100, 38101, are considered separate procedures, and therefore, you know this answer, would not be reported if another procedure was reported or completed. There is also, by the last code, which is an add-on code, denoting that that is an add-on code. And that is an add-on procedure that is reported when a total splenectomy is reported in conjunction with another procedure. There is one repair code in this section. This is for a ruptured spleen, and the procedure is known as a splenography. All right, laparoscopy of the spleen. There is a note that appears, there's notes that appear everywhere, and it tells us that, you guessed it, surgical laparoscopy of the spleen includes the diagnostic procedure. There are 2 codes available in this family. The first one is for a surgical laparoscopic splenectomy, and then you have a unlisted laparoscopic procedure on the spleen. The next code in this subsection is 38200. This is for injection for a splenoportography. And there is an instructional note that tells us if supervision and interpretation occurs for this procedure, you're going to use that appropriate radiological code. Next up, we have a code family for general procedures, more codes that are out of numerical sequence. And these codes report transplantation and post transplantation cellular infusions. There are several notations that appear in this area, like you can only report this once a day. Also, over here, you will see that these codes for things like diagnostic, bone marrow aspiration with a S on the end. So aspiration, aspirations, biopsy, biopsies. But then you also have a code that says they do a biopsy and an aspiration together. Let's see what else. Next up, procedures on the lymph nodes. And in this area, it should be noted that even though the lymph nodes are located throughout the body, there are four major concentration of lymph nodes. Cervical, located in the neck area; submandibular, which is located under the mandible or lower jaw. And I don't know if you remember seeing maxilla. Now we're seeing mandible. So I always remember maxilla like right below my nose, and then mandible my actual jaw. Okay, then we have axillary, which is located in the armpit, and then we have inguinal, which are located in the upper femoral triangle of the thigh. Inside of these procedures, for the lymph nodes, you have incision, excision, lymphadenectomy, laparoscopy, introduction, and other procedures. So, as it relates to the procedure for incision, um, incisions are completed on the lymph nodes and lymphatic channels. And the first few codes are used to report drainage of a lymph node abscess or drainage of an inflamed or enlarged lymph node, such as lymphadenitis. And these codes are differentiated by the terms simple and extensive. And we need to see documentation of why it's extensive in that note. We also have codes for incision into a lymph node. So lymphangiotomy, octomy, Otomy. Then we also have suturing and ligation of thoracic ducts that are available. These codes are differentiated based upon if it's a cervical, thoracic, or abdominal approach. Then we have excisions of lymph nodes, and here you'll see things like biopsies, excision, dissection of the lymph node. You got to read that report to identify how was the procedure done, right? Was it open or was it completed using a needle? Um, Whether or not the biopsy or removal was superficial or deep. Superficial biopsy is performed on the lymph node that is close to the surface of the skin, whereas a deep biopsy or deep removal is referring to nodes that are located by or below the muscle. So you got to know what they actually did. So, how deep it was, right? Superficial or deep. All right, next up, we have the limited lymphadenectomy. And there are two codes for limited lymphadenectomy for staging. Both of these codes are separate procedure. They're differentiated by the location. Location being pelvic and para-aortic area or the retroperitoneal area. There is a note over here in the CPT manual that says when this procedure is performed with a prostatectomy, um, and when combined with insertion of a radioactive substance, it tells you to see somewhere else in the manual. So I always say read the subsection notes, read where your code begins to where your code ends. All right. Another scope, laparoscopic procedure for lymph nodes. And these codes, of course, the diagnostic is included into the surgical. These codes are divided based upon the site performed. And something I should call out regarding biopsies in the surgical section, you're going to see that a lot of codes are reported, that like the one code is reported if it's a single biopsy or multiple biopsy, right? We're not getting to report multiple codes. And the radical lymphadenectomy. And radical is where all lymph nodes are dissected and removed, as well as the tissue under the skin. To select the correct code, you need to know the site and the extent of the removal. You also need to know if it is unilateral or if it is bilateral. Whew. And lastly, additional procedures that are over here. You have injection procedures. So, like for a lymph angiography, there is a note there that tells us that code 38790 is a unilateral code. So, if the lymph angiography is done bilaterally, modifier 50 is assigned. You also have add-on code 38900, which is for identification of a sentinel lymph node, but it is an intraoperative identification of a sen- sentinel lymph node. And then, of course, we have an unlisted code, and we made it to the end of part number 5, where we focused on the hemic and lymphatic system, anatomy, procedures, guidelines. Go and be great coders. I'm going to go and now prepare for Super Bowl Sunday.